Good afternoon, everyone, and thank you for joining us for this live conversation on stroke. May is National Stroke Awareness Month, and according to the CDC, someone in the United States has a stroke every 40 seconds. So today we're joined by Dr. Kim Gannon. She is the medical director of the ChristianaCare Stroke Program. Dr. Gannon, thank you for joining us. Why don't you take a minute to introduce yourself to our viewers?
Sure. Thank you so much for having me. I'm really excited to be here and talk about my favorite thing, to spread information about stroke. So I am proud to represent ChristianaCare and glad to be the medical director of the stroke program across our 3 campuses. So I'm excited to speak with our team today.
So before we get started, I just want to remind everyone, if you're watching and have any questions for Dr. Gannon, please leave those questions in the comments below and we'll get to them throughout our conversation. So Dr. Gannon, let's start big picture. Some people are still struggling with the definition of what exactly a stroke is and how a stroke happens.
That's a great question. So a stroke really is an area of damage to the brain, and that can happen in a couple of different ways. Most of the time when we think about stroke, it's because a blood clot came from somewhere and blocked up a blood vessel in the brain. Just like you would think about a pipe getting blocked up. If the blood vessels in our brain get blocked up, we're not getting sufficient blood flow and therefore oxygen to the brain. And when our body doesn't get blood flow and oxygen that it needs, that tissue, including the brain, will die or stop working. That's called an ischemic kind of stroke or a blood clot kind of stroke. The other kind of stroke, which is just as important but a little less common, is a hemorrhagic stroke, meaning that you have bleeding into the brain. The same symptoms can really result from either of those types of strokes because it matters what area of the brain is affected, whether there's too much blood into the brain itself or whether the blood flow is blocked from the brain. Both of those can cause significant damage.
Is there a specific population that's more likely to suffer from a stroke?
So in general, our population who's over about 60 years old in the United States is at a higher risk of stroke. And the things that we need to be careful of is all of our risk factors. So regardless of what age you are, if you have a lot of the risk factors for stroke, that's going to put you at a higher risk. And those things that we're thinking about in particular are high blood pressure, high cholesterol, high sugar or diabetes, and a family history of stroke. And if you use any tobacco products, all of those things put you at a significantly higher risk of stroke compared to somebody who doesn't have those risk factors.
So a few of those risk factors sound like things you would get from your parents or, it's that family history of high blood pressure maybe, but what are those things that potentially are lifestyle changes? So you mentioned smoking. Are there other things that you may be putting yourself at risk and you don't even notice it?
Yeah, that's a great question. So one of the best things that we can do for ourselves is prevention. So making sure that we know about our risk factors, and that means going to visit our primary care physician. Making sure that if we have high blood pressure, we know about it. That's something that people can overlook a lot of the times, even young folks who don't see a doctor maybe regularly because it's not painful. It's not something that's causing them a problem in their day-to-day life. So we may not even know that we have high blood pressure. And the same thing for high cholesterol. We can certainly get that from our family, but sometimes it can also be because of the diet that we eat. And it's not painful either. So we might not know that we have it unless we're seeing our physicians who can check those levels, or check our blood pressure level or check our cholesterol level to really see if we have those risk factors. And then knowing about those things that we have as risk factors for ourselves can really help us modify our lifestyle. So that means doing healthy things for ourselves, getting at least 30 minutes of exercise most days of the week, having some cardiovascular activity if we're able to. That means getting our heart rate up, exercising vigorously a couple of times a week, and trying to eat a really heart-healthy diet. The diet in particular that's recommended by the American Heart Association is called the Mediterranean diet. What that means is eating a lot of white meat as opposed to red meat, so steering clear of our beef, things like this, eating more of our fish and chicken type meats, and really stocking our diet full of our vegetables and our fruits. And if we like to drink any alcohol, really keeping that to a minimum. For men, it's recommended that we drink less than 2 glasses of alcohol a day, and for women, less than 1 glass of alcohol. So that's one of the biggest things that we can do to keep ourselves healthy and prevent ourselves from having a stroke. So knowing our risk factors and making sure that we're modifying our lifestyle to reduce those as much as possible. And then tobacco smoking, like you mentioned, is really one of the biggest things that we can modify. Not only is it important from our lung standpoint, But we think that that tobacco puts you at a significantly higher risk of both heart disease and of strokes. And the blood vessels all over the body really just don't like that much. And that's one of the biggest things that we can do to reduce our risk factors.
And how would someone know if they're having a stroke? What are those telltale signs?
Perfect. I love to talk about this. I was actually just telling my son's class in first grade about these things yesterday. What we want to look out for is kind of the big three that the American Heart Association puts out is able to be remembered with the FAST acronym. So FAST. So the F stands for face. So if you ever notice anyone who has a facial droop or weakness on one side of their face, the A is for arm. So arm weakness. If you notice that an arm is not being able to be held up as it should be. The S is speech. So if somebody's speech is slurred, they're not being able to articulate the words as much as they should be, or if they can't seem to get the words out, like they can't process to speak words or they're saying the wrong words altogether, that's when the T comes in. It's time to call 911. So those are the big things to look for. Facial droop, arm weakness, speech difficulty, and then it's time to call 911. Other things can be signs of stroke, but can be a little bit more hard to pick up. If people lose vision in one eye or can't see over to one side out of both of their eyes, or if they get very, very dizzy all of a sudden, sometimes these things can be symptoms of stroke also.
So if you think you are having a stroke or one of your loved ones may be having a stroke, what should you do immediately?
So the biggest thing is to call 911. This is something that we really want to hammer home to everybody and have everybody tell their family and friends about it. We don't want you to come to the hospital driving yourself. Something could happen along the way. Your stroke could get worse, and that could be devastating in the way of a car crash for you or somebody else on the road. By the same token, we don't want our family members to be driving us to the hospital. Heaven forbid something happen on the way and they can't get you here fast enough for some reason. We really want to rely on our medical system and the 911 system to bring patients to the emergency room. The other thing that calling 911 actually does is when you get in the ambulance and those emergency medical personnel notice that you're having symptoms of a stroke, they actually call our team at the hospital to give us an alert, a pre-hospital alert. And what that does is it activates the emergency room team and all of the stroke team also, so that we know you're coming before you even get here. That prepares our team, that prepares the nurses, and also the imaging technology that we're going to need to take a picture of the brain really quickly.
So we do have our first question from our viewers. Doug asks if there's a connection between COVID and if that impacts stroke.
Great question. I think a little bit the jury is still out on this. We've been doing COVID now for a year, unfortunately, and there's a lot of mixed information. We know that COVID puts you at a hypercoagulable state. That means it makes your blood thicker than the general population. So we think that there might be a link. We don't want to say that everybody who has COVID is at increased risk of stroke because we're not sure whether that's the case or not. But regardless of COVID, we want to make sure that we're always as vigilant for stroke symptoms, whether we're having active COVID symptoms, whether we've had COVID before, or whether we've never had COVID. We want to make sure that we're aware of the signs and symptoms of stroke because we're able to treat you regardless of what caused your stroke.
And it's important to remind people that it is safe to come into the hospital for stroke. You know, we were speaking before this, and I know we spoke around this time last year on the same topic of, you know, don't let COVID deter you from seeking help.
Exactly. You know, the best way for us to treat stroke is acutely. That means right away, as soon as you notice symptoms. Coming to the hospital and seeking care right away is the best opportunity for us to be able to restore you to your normal function like you were before you had your stroke symptoms. The hospital has done a remarkable job over this past year and continues to do so to make sure that our patients and our staff are safe. We take all of the appropriate precautions, and really the hospital probably is one of the safest places to be. Everybody here is following the protocols, making sure that our patients stay safe. And we really want to remind people that it is a safe place to be, and especially if you're having acute symptoms that really do need that emergent attention, like an acute stroke.
Absolutely. So Dr. Gannon, before I let you go, talk about the Comprehensive Stroke Program and what we do here at ChristianaCare.
So our Comprehensive Stroke Center is really special to me for a lot of different reasons. We're actually the only comprehensive stroke center in between Philly and Baltimore. and the only center in the state. So that puts us at a really unique position. We care for a huge number of patients, and we're really proud to care for our patients in the state of Delaware. We find this important to care for our home population and our community. What a comprehensive stroke center is, it's a whole group of people and teams that can take care of all aspects of stroke. So that means taking care of you acutely when you come to the emergency room, giving you medication through your IV to break up your clot, or going for what we call mechanical thrombectomy, or where we actually physically remove the clot from your brain by our neurointerventional surgery team. We have our critical care specialist in neurology who take care of our patients, and then thinking about how to get patients out of the hospital too with our rehab specialist. So all of these team members together make up the heart of the comprehensive stroke program. And really what that is putting all of those people at one location to focus our attention on patient care. So you don't have to go out of state, you don't have to go to multiple different locations to receive this care. It's important that we're able to provide all of that care right here at ChristianaCare.
That's great. We do have one more question that came in from our viewers. Katie asks, do you recommend those with comorbidities post-COVID go on medication to avoid stroke?
So usually we do. This is individualized, but a lot of times we do recommend that our post-ischemic stroke patients, so we'll need to usually take a baby aspirin every day and usually work on cholesterol medication also. This is specified for each patient individually, so I can't make a blanket statement for all of our patients, but most of the time, those are the medications that we recommend after patients have a stroke to help reduce their risk of stroke going forward. And if patients have specific risk factors, especially something like atrial fibrillation that puts them at an even higher risk of stroke, we have to think about other types of blood thinner medications for them to be on long-term to reduce their risk of stroke as much as we can.
Thank you. And we have another question from Teresa. She asks, when you have had a TIA, does that make you more prone to a stroke?
So we are concerned that it does in the short term. And really with the TIA, we want to make sure that we're as vigilant about taking care of those patients as we are as stroke patients. For anybody who doesn't know, a TIA is a transient ischemic attack. Some people like to call that a mini stroke, but that's kind of not the right word that I would use. And the idea of a transient ischemic attack is where a blood vessel in the brain is trying to get blocked up, but thankfully that blood vessel opens back up before it can leave any long-term damage, and the symptoms of a TIA resolve over time. The reason that it's important to find out and investigate, come to the hospital for that TIA, just as you would for persistent symptoms, is because we want to find out why you had that. Before we know why you had that episode of a TIA, may be at higher risk of stroke for reasons that you might not be aware of. And we may be able to mitigate those risks with either interventions or medications so that you don't go on to have a larger stroke that would leave permanent damage for you.
Thank you. And it looks like that was our last question for now. So after we log off, if you have any other questions, please continue to post those in the comments and we can answer them with Dr. Gannon after this live program. So Dr. Gannon, one last thing, what is the most important thing you want viewers to take away from this conversation today?
If you have acute stroke symptoms, I want you to come to the hospital by 911 as quickly as you can. And try to remember that FAST acronym, face, arm, speech, and time. And tell as many people as you can.
Thank you so much for joining us. And if you have any other questions, as I mentioned, please leave them in the comments or visit our website for more information. You can find that link in the comments as well. Thank you and have a great afternoon.
Thank you.